Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. And in this edition, we're actually going to do another Q&A. So if you want to see if your question is being answered on this video, definitely stay tuned. All right, we are back. My name is Dr. Marita P. I'm a registered nurse, been a nurse for almost 17 years. And tonight, it is nighttime here in Nashville, Tennessee. I am actually going to do a Q&A and answer some of your nursing questions. And some of these questions I actually got on TikTok and thought they would be great for this video. Now, these questions are not OB specific or postpartum specific. A lot of them have to do with either my thoughts on nursing, my DNP journey, just different things like that. So I want to go ahead and answer those questions here, and we're going to go ahead and jump right on in. So the first question I have was from TikTok, and I do have my notes right here, so I can go ahead and be looking at those while I'm answering the questions. So the first question I have on here is baby-friendly hospitals, and what are my thoughts on baby-friendly hospitals? So when it comes to baby-friendly hospitals, just so you understand what that means, baby-friendly hospitals are hospitals that they are, I wouldn't say all of them require, but most of them are pushing the breastfeeding initiative. So if it's a baby-friendly hospital, many of them are pushing the breastfeeding initiative when it comes to how to feed the baby. And also they push the initiative of rooming in, meaning they may not have a actual nursery for the baby to go back to if mom needs a break. So what are my thoughts on baby-friendly hospitals? So the gist of it is this. I take no issue in general with baby-friendly hospitals, but the issue that I do have is the facilities, the doctors, the nurses, the lactation people who have an agenda to make moms not have a choice. That is the issue I have with that kind of things. Meaning that if I want to breastfeed, I can breastfeed. But if I want to bottle feed, you all make me feel guilty that I want to bottle feed and really try to push the breastfeeding agenda or initiative. That I don't agree with. I worked at a hospital in which we were considered to be baby friendly, and they wanted all moms to breastfeed their babies, and that's what they were pushing, meaning that they were not providing any formula to any baby unless it was a medical reason as to why the baby had to have formula. If it didn't have a medical reason, the baby didn't have a medical reason to need formula, then they were not allowed to have formula. And what I actually happened to notice is the ones who really wanted formula, maybe even just for the night, maybe they were going to breastfeed, but they had a rough delivery. They just wanted it for the night or two or whatever. They were not allowed to have it. They were very frustrated, and so was I. I do not believe in making anybody feel guilty about their choice of how they feed their baby. Breastfed babies are great, and bottle-fed babies are great. Bottle-fed babies survive and do just as well as breastfed babies. I know what the research states in terms of breast is best, but breast is not best for everyone. And let me explain to you why it's not best for everyone. I've had many patients who are rape victims, who've been molested, who've been touched in a certain way that is not appropriate. They do not want to breastfeed. And because they have the history of abuse, basically what that is, why should we make them do something they don't want to do that's not natural to them? So again, it's about a choice. But no one asks those kind of questions when they're asking you about what you want to do when it comes to these baby-friendly hospitals sometimes. Now, all hospitals are not the same regarding this. Some hospitals are baby-friendly, but they still allow the patient to make a choice about what she wants to do regarding feeding her baby. But like I said, I've worked at a hospital that was not as friendly when it comes to moms making a choice about how she wants to feed her baby. So as long as moms have a choice on how they feed their baby, I'm all for it. Again, we have moms out there who do not want to breastfeed for various reasons. Reason number two that I want to say is that keep this in mind as well. We have a lot of moms who have histories of depression, bipolar, schizophrenia, things like that. And because they need to be on certain medications that are not breastfeeding friendly, then we would make those moms feel bad because they couldn't breastfeed because of the fact that they are needing their medications for their mental health. People don't understand mental health is more important. Mom's mental health is more important than how she feeds that baby, because if mom is mentally unstable, If she is mentally unstable, she's going to end up killing or harming that baby somehow, some way. Okay, I've seen it happen. So I don't like when physicians, lactation people, or whoever make it a point to say, okay, breast is best for everybody. Whatever mama wants to do to feed her baby is what she need to do to feed her baby. If she wants to breastfeed, I support her 100%. If she wants to bottle feed, I support her 100%. If she wants to do both, meaning she wants to breastfeed and then supplement with formula or however she does it, I support what want to do to take care of their baby. That's what I feel about that. So that's the question on that. That was a great question. The next question I have was for another question I got was, did I find that I have more teaching opportunities with my DNP? So I have a doctorate of nursing practice, a DNP. Now, since I've received my DNP, do I have more opportunities for teaching than I did without? And the answer is yes. Most universities require you to have a doctorate anyway. So when you have a doctorate, then you tend to have more ability to, you have more options. I always tell people more education means more options usually. And most nursing programs are wanting their faculty to be doctoral prepared, whether it be DNP, EDD, or PhD. They want them to be doctorally prepared. So yes, I have more options or more opportunities to teach now that I have my doctorate than I did before. And I will say this, you have to have one level higher than what you're teaching. So if you're teaching the master's program, you have to have a doctorate to teach that. If you're teaching LPNs, then you have to have at least typically an associate's to teach them, or a bachelor's degree to teach an associate's degree, a master's degree to teach the bachelor program, and on down. So yes, the more education that you have, the more you're able to teach. And I can actually teach online now. So a lot of these schools that are exclusively online programs, I have the ability to now teach those courses, which is something I've always wanted to do, which means I can sit at home, or I could be at the beach and actually teach my classes and make thousands of dollars a month just by sitting at home if I chose to do that. So yes, to that part. Her second part of that question is about my CNE, to be a certified nurse educator, which is a certification. Where am I on that? I plan on actually getting that next year. I really wanted to take a break from any type of schooling, education, studying for about a year. I just graduated in August 2020. I just wanted to take a break from all of it for the next year, or for the year after. And my year is up now. So I'm actually about to purchase my CNE study materials. And nursetim.com has a webinar for nurse educators to sit and to learn and to do the prep work for that CNE. And I plan on watching that and doing that webinar so I can learn what I need to learn to pass the CNE the first time. So I do plan on getting it, but for me personally, I'm going to wait till next year to take the test. I'm going to spend the next year studying after I just finished taking this year off. All right. So the next question is, what are some prerequisites that are needed for success in nursing school? So this was a question on TikTok as well as on YouTube, here on YouTube. So some questions that, some prereqs that you need to be successful is this. Prereqs that are required for nursing school are your Englishes, your math, things like that, statistics, psychology, some places require food and nutrition. But let me go into the ones that you happen to need directly for nursing school success. Those classes are Anatomy and Physiology 1 and 2. That is a foundation. Those are foundation courses to nursing school. You need A&P 1 and 2. And you need to have an understanding of those courses, and in which that means you know how to explain this to somebody else. To know how the body works, you need to be able to tell that to someone else. So A&P 1 and 2, you definitely need. You need microbiology, and you need pathophysiology if that's not a separate course. If it's a course within another course, then that's fine, but you need A&P 1 and 2. You need pathophysiology. You need microbiology, and of course you need the labs that goes with those courses as well. Those are your sciences that you really need, that's going to really help you with nursing school success. Those are the prerequisites that you have to really help you build for nursing school. All the other prereqs that you have to take, such as your psychology class, yes, that's beneficial. It just helps you with people skills, understanding how people work and how they think and how they move. Sociology is helpful. Of course, English and history and all that stuff is helpful to make you more well-rounded. But in terms of direct prerequisites for nursing school, those science classes is what you need. All right. So the next question is, what are my thoughts on nurse residency programs? My thoughts on programs is that everyone, especially now during COVID, that COVID has happened and we had this pandemic that we're coming out of, I think that everyone should do a nurse residency program. Meaning, what are they? So those programs are basically where you will be hired by a hospital, and before you get assigned to a specific unit, you will probably go through about a good 6 months to a year, depending on the program, because some programs are 6 months and or some of them are a year. And all you have to do is they will put you in different rotations. So I don't know how long they are, but let's just pretend that for a month, okay, that you're going to be in med surge. Okay, so they may put you in med surge for a month. You learn what you need to learn over in there. Then you go over to maybe ER. We'll do that for a month. Go do, then so forth. Go to OB, whatever happens to be, that you do it for a period of time. That 1 month, I don't know if that's true or not. I'm just saying, however long they have you somewhere, that's how long they have you there. You learn all you can learn in that. And then typically by the end of your residency, you will be able to pick the specialty that you want to pick, that you like the best. And then that's where you will go to work for your nursing career, if that's what you choose to do. So I think nursing programs or nurse residency programs are a must, especially now that we have had COVID, and that a lot of you all who are coming out of nursing school may or may not have had the opportunity to have clinical. And if you did not have clinical, when I mean clinical, I mean on-site clinical, not simulation, not virtual, not stuff like that. On-site clinical where you actually took care of patients. A lot of you didn't have the opportunity for that. So at least the school that I teach at. So if that's the case for you, then I think nurse residency programs for you will definitely be a benefit. But for everyone, I recommend everybody go to a nurse residency program when they finish school. So let's see, another one I had. I think that may be all the questions that I have. Nope, here's another one. So I had another question that asked me, this was a TikTok question. They asked me specifically, did I have a minor in nursing school? When I was in nursing school, did I have a minor? So, you have a major of nursing, did you have a minor? And for me, or do I recommend having a minor when it comes to nursing school? Now, for me, nursing school was all I could do. So for me, I did not have a minor in nursing school. I didn't want a minor in nursing school. But I do know that some people can take a minor in nursing school. But if you have time for that, best wishes to you. It's hard enough to go to nursing school. But no, I did not have a minor when I was in nursing school. Nursing was my major, and that's all I did for that. Now, also, I will say this. I have 2 bachelor's degrees. So for my first bachelor's degree, I did have a minor with that one. So I majored in psychology and I minored in secondary education with my first bachelor's degree. With my second bachelor's degree in nursing, I only had the nursing. I didn't have a minor for that. Didn't need a minor for that. Wasn't interested in a minor for that. All right. Next question was, somebody asked a question specifically about my title. And this was a TikTok question. So the question was, what do I call myself, or what do people call me when I'm out in public with my title? And I've kind of alluded to that in another Nurses Week video in terms of what my title is. But my title is Dr. Marita P. And so I don't use my title when I'm working in a clinical setting. So meaning if I was working as a bedside nurse still, I would not use my title at all as doctor, because it's confusing to patients. It's not misleading, because I do have that title. I did earn it, but it's confusing. So in the hospital setting as a staff nurse, I do not use that title, but I do use that title in academia. That is how I'm addressed in academia, as Dr. Marita P. or whatever. And I'm addressed that by students and by my colleagues as well. So that's how we address one another, as Dr. such and such. Another great question I get oftentimes on YouTube as well as on TikTok is, how do you get into education? People want to know, like, how do I get into nursing education? I think I want to become a nurse educator. I think I want to teach. I think I want to do this, that, and the other. Well, how do I do that is what they want to know. And so to answer that question, how do you become a nurse educator, is many ways. But what I suggest, the easiest way to get into it is, if you feel like you want to teach, is to do some clinicals first. So basically, when you become an adjunct clinical instructor, adjunct means part-time. So when you're an adjunct clinical instructor, it means you don't have any benefits. That all you do is you'll take a clinical group based on your specialty to whatever area of nursing that they need you to take you to. So they'll have a hospital or whatever, usually a hospital, and you will take this group of students to You'll take this group of students to the hospital and teach them what it's like to be that kind of nurse, and to basically bridge the gap between the didactic, which is their coursework, as well as the bedside of it, or the clinical side of it, and put those two together, see how they connect. That is your best way to get into education. I tell people, start there, see if you like it, because academia is not what people think it is. And also, which I'll get into this in another video, people tend to think that what my job is as a nurse educator is to basically come in and do your vital signs and tasks, and that's the least of our worries when we're in clinical. But I will get into that in another video as well. But the good way to find out if you like teaching is to take some students and show them what you know. As you know, typically you're going to do clinical in an area that you actually do work. So if you are an ER nurse, maybe you would take them to either the ER, take them to the med surg, or take them somewhere like that. Because basically you could do the same thing. And show them what you know. Teach them what you know. Show them and see if you like education from that standpoint. Because if you do like it from that standpoint, when you ask their questions, and you do have to grade papers, you grade care plans, you have to grade different things like that. You have to make sure that they are in their uniform, dressed appropriately from head to toe, making sure they follow policies and procedures. It allows you to kind of get into academia without being into it full time. And that way you can make a decision. Is this something I really want to get myself into full time? Do I like it enough to deal with the antics of dealing with students? Am I patient enough to deal with adult learners? Am I patient enough to deal with these millennials or some of these non-traditional students? Am I patient enough to deal with that? Am I prepared to be in clinical for 12 hours a day? Am I prepared to have to go and talk to nurses and being ridiculed by the nurses and things like that, the actual nurses on the floor? Am I open to being ridiculed by the students who think I'm not competent when you actually are? You know, it's very hard to get into education in terms of the dynamics, the logistics of it. But in terms of if you think you want to be a nurse educator, try the clinical route first. Now, you may be asking, well, how do I get into it? What do I need to look up? If you go to any university online to their job search, a lot of times they will have it online that they're looking for a clinical instructor. So start there. Number two, a lot of times it's word of mouth. I've gotten many of my clinical instructor jobs by somebody who knew me, not because I went on Indeed or anywhere like that. So if you happen to be in education and you want to reach out to maybe the school that you went to school at, if you're still near there, and basically find out, hey, if y'all happen to need any clinical instructors, I'd be happy to come on and learn how to do that. So definitely learn to network and meet up with people in that way, so that you can see if this is something you want to do. Again, all the jobs I've had for clinical, except for one, for clinical instructor, is not because I went to Indeed or Career Builder or anywhere like that. It's because I knew somebody who said, hey, we need someone. Can you do this for us? And I'm like, yeah. So that's kind of how I got into it. But that is my recommendation for you to get into the clinical side of education. Start there first. So I think, I'm trying to see, is that the last question? This is the last question right here. The last question that I have, this question came from TikTok. So the last question I have is, she asked the question about certifications for postpartum. She wanted a job in postpartum, and she wanted to know what classes should she take to prepare her for postpartum, number one. Her second question was, what certification should she go ahead and get done? Now, listen to this carefully. I told her that when it comes to being a postpartum nurse, getting a job in postpartum, there were no classes that I took to get into postpartum outside of my nursing classes, because I came into postpartum directly out of nursing school. So my maternal newborn classes that I took in nursing school were the only classes that I took to get me into postpartum. That helped me with postpartum, shall I say. The rest of it you're going to learn on the job anyway. So you're going to learn everything on the job. They'll teach you everything on the job. Now, when it comes directly to certifications, this is true for postpartum as well as any other certification. To get a certification in something, it's not something you do in advance. You do that after the fact. You have to have so many years of experience in that certification, in that specialty, to do a certification. So like I was talking about with the my CNE, Certified Nurse Educator. Well, I can't, say, okay, today I'm going to be an educator, let me get certified in it. You get certified after you have years of experience doing it. And I have almost 16 years of experience being a nurse educator. So for me, I have enough hours or years put in that I can actually go sit for this certification, of course, with studying. So you have to have years already done in that specialty area in order to sit for the certification for that specialty, for that exam. So in postpartum, there is a mother baby certification that you can do if that's what you choose to do. So with that being said, go ahead and take that certification after you have about 2 to 3 years of experience. Then get the certification in whatever specialty you happen to want to get it in. But in this case, it was postpartum. So that concludes my Q&A for this video. Thank you all so much for those questions. I love answering these questions. So if you have questions for the next Q&A, you comment them below or go over to TikTok and ask them, and I'll bring them right back over here and I will do another Q&A for you all. I'm still working on going live so we can answer questions live, but I'm having difficulty with YouTube right now trying to figure out the logistics of why mine is reading error as to why I can't go live right now. But anyway, I meet the minimum criteria. Otherwise, I just need to figure out if it's a technical issue or whatever. But anyway, until then, definitely continue with putting your questions down below. And I will definitely answer your questions over there or over here. So feel free to do that. I look forward to answering those questions. Also, follow me on IG. You will see the handle here. And your girl's on TikTok, like I said. Follow me here on TikTok. Ask your questions over there. I'll be happy to answer them. Until the next time, take care. Bye-bye.